PCOS 101. If you've been diagnosed with PCOS, you need to watch this video. I'm Dr. Sidhu, and I am a family practice and a lifestyle medicine doctor. I'm also the proud founder of Spring Monarch Primary Care, a direct care practice here in Houston, Texas. If you're in Texas and you've been looking for a doctor and you want to work with me, I've linked my practice in the captions below. All right, let's dig in. So PCOS, which is polycystic ovarian syndrome, is a disorder that you would think is primarily due to the ovaries having a problem. But the truth is that PCOS is actually a metabolic disorder, and it is not necessarily just a fertility disorder, as you may have previously heard. In fact, that is a myth, because it is the metabolic dysfunction of PCOS that causes infertility. So basically, infertility is a symptom of PCOS, but PCOS is not a fertility disorder. And because we have labeled PCOS as a fertility disorder, we are missing the mark. Meaning, when women have PCOS and we primarily treat the fertility dysfunction, we are missing a whole host of other things that could go wrong. So I'm going to get into that, a little bit of that today. First of all, let's talk about the symptoms. So what are the symptoms of PCOS? Since the main driver of PCOS is insulin resistance, we often see elevated sugars, we see darkening of the skin, but we also see other symptoms of PCOS driven by high androgens, or the male hormones, like acne and abnormal hair growth. So women will be losing hair on the top of their head, but growing hair, it feels like, everywhere else. PCOS women also tend to store fat in very particular spots, particularly around the stomach. Additionally, we see irregular or missed periods. We also see mood swings, fatigue, sugar cravings, all kinds of things. And so all of these symptoms together, put it together and you've got PCOS symptoms. But how do you know that your acne is due to PCOS or your hair thinning is due to PCOS? Well, in order to really know, you have to understand the diagnosis of PCOS. So in order to meet the criteria for diagnosis, you have to have certain symptoms, and we're going to dig into that. But first, we're going to talk about the 4 types of PCOS. Now, when I was in medical school, or maybe later, we learned about the phenotypes, A, B, C, D. But that really just doesn't make a lot of sense to most of us, and it's hard to remember. So I'm going to explain the 4 types of PCOS in a way that is very easy to understand and very easy to recognize. All right, number 1, we've got insulin-resistant PCOS. This is the most common type of PCOS. It is basically driven by blood sugar dysregulation. Think fatigue, sugar cravings, carb cravings, and stubborn weight. Type 2 is adrenal PCOS. This is driven by stress. The trigger is stress. So often instead of high testosterone, we see high DHEA. And these patients will often tell us they feel tired but still wired. And they'll notice that their PCOS tends to get worse in times of stress. Number 3 is inflammatory PCOS. This type of PCOS is driven by inflammation. Oftentimes it might be due to something autoimmune, poor sleep, gut issues, environmental triggers. All of these symptoms can raise your androgens, and these patients often present with digestive symptoms, fatigue, and other autoimmune diseases. Number 4 is post-pill PCOS. And what that means is this is temporary effect of coming off the birth control pill. The hormones rebound, the cycles become irregular, and it looks like PCOS. But the good thing is this one usually resolves on its own after a few months. Now that we understand the 4 types of PCOS, I'm very curious, let me know in the captions if you recognize that you have one of these types of PCOS, because it's really interesting when you learn the 4 types and realize why your symptoms don't seem typical when it comes to other people. All right, now let's talk about testing for PCOS. Typically, we use the Rotterdam criteria, and that means that you have to have 2 out of these 3. Number 1, irregular cycles. Number 2, cysts on your ovaries. And number 3 is signs of high androgen. That means that you don't even have to have a single cyst on your ovary to get diagnosed with polycystic ovarian syndrome. You just have to have either irregular cycles or the cysts and or signs of high androgens like acne and abnormal hair growth. Okay. Now that is the criteria for diagnosing PCOS, but I like to dig a little bit deeper because women with PCOS may also have food sensitivities, they may have low vitamin D, and they may have other things going on in their labs like pre-diabetes and of course insulin resistance. So to do a thorough workup, I like to do this additional workup, and that can really benefit patients into making a customized treatment plan for them. All right, now we're going to talk about my favorite part is what do we do about PCOS? And today particularly, I'm going to talk about lifestyle changes. And first, when we talk about lifestyle changes, we need to start with nutrition. So in the past, we have told PCOS women to really stick to the low carb diets, high protein and all of that. And what we've really learned is that women with PCOS do better with a plant-forward diet. So whole foods, heavy on the plants, heavy on the fiber, that's how women do the best. It helps regulate their blood sugar and their hormones. That doesn't mean you need to go completely vegetarian, but if you do choose to eat meat, really make sure maybe half your plate has your non-starchy vegetables. Make sure the starches that you are eating are high quality starches, like with a lot of fiber, and make sure that the meats that you are eating are high quality meats, organic meats, not fed with a lot of hormones and antibiotics. The next thing we need to talk about is movement. Movement is amazing for PCOS. And when I talk about movement, I am talking about not like a bunch of HIIT and not like going intense to just kind of get rid of everything. I'm talking about steady cardio, walking 30 minutes, 5 days a week, and really incorporating strength training at least twice a week can be massively impactful for PCOS. All right. The third thing is stress and sleep. We just mentioned that stress can cause an entire subtype of PCOS. Stress is a major driver of hormone imbalance. And so managing stress is super important. Now, none of us can really completely get rid of stress. So making sure that we are managing chronic stress by adding in meditation, journaling, taking breaks, closing the cycle for stress. All of these things can help your body start to calm down before it has to head into its next stressor. Also, getting about 7 to 8 hours of sleep is super important. Protect your sleep. Go to bed 15 minutes earlier, no screens before bedtime, no caffeine after noon. These are all ways that you can get better quality sleep. And then we talk about supplements. So what supplements do we like for PCOS? Now, we like to do food, nutrition, movement first, but women with PCOS do really well with certain supplements. And number one that everyone is talking about is inositol. And it works. It really works really well for women with PCOS. Vitamin D, omega-3 are great also. So is zinc. And if we got to go to the medication side, metformin is a great medication for PCOS, and the GLP-1s are also now showing great promise for PCOS. So that's on the supplement and the medication side. All right. I hope that you understand your PCOS a little bit better. It is super, super important that we understand that yes, women with PCOS are at risk for infertility, but they are also at risk for diabetes, high blood pressure, fatty liver, certain types of cancer, endometriosis, needing a hysterectomy, depression, all kinds of things. And if we just keep talking about PCOS as a period problem, we are missing the mark for a major driver for these women for all these other chronic conditions. And so we really, really need to change the language around PCOS and start calling it a metabolic disorder rather than a fertility disorder. So women with PCOS can really get the care that they deserve and change the outcome of their health going forward. If you found this video helpful, please like it. If you want to see more content like this, please hit subscribe. If you're in Texas and you want to work with me to help your PCOS heal and get better, please see information about my practice in the caption, and I will